Thank you very much, Mr. Chairman, also for the invitation this year. I send my warmest regards to all my friends in China and wherever you're listening right now. You hear me speaking from Frankfurt, Germany today. And I was actually very happy to hear that even under the given circumstances, this beautiful forum would be kept alive. And I've got the special honor today to talk about the main reason we are not enjoying ourselves right now under the tropical sun of the Pacific Ocean, just like last year. As we all know, the world has changed dramatically within the last year, and I would like to give you a short review of what happened so far in Germany and in Europe, and what the current situation looks like, and discuss future scenarios with you. But let's start with the spread of the virus. That must have been end of November or early December 2019, when a new lung disease was discovered in the city of Wuhan. And quite early, it became clear that it was due to a new type of virus out of the family of coronaviruses. And in the month to follow, this virus would spread around the globe and fundamentally change the world as we knew it on many, many levels: economically, social life, healthcare, traveling, politics. Nothing would be the same again. So the first European cases of COVID-19 were diagnosed around the 24th of January. That was in France. And only days before the virus actually came to Germany. That happened in a region close to Munich in the south of Germany. That was our first COVID-19 case. But the COVID-19 name didn't even exist at that time. It wasn't until February 11th, before the World Health Organization labeled the new lung disease coronavirus disease 2019, or short COVID-19. Which soon would be everything everybody talked about. And by mid-February, there were already cases in almost every European country. Especially Northern Italy was affected the most, to an extent where the government had to lock down whole cities and people were actually required to stay inside their house. Fortunately, it never came that far in Germany. On the 27th of March, a German task force had formed to guide the way through this crisis with members of the military, scientists, politicians, so all sorts of experts. And in early March, the book fair was one of the first things that got canceled. And soon pretty much every major event nationally and internationally would be canceled, like the European Soccer Championship, the Olympic Games in Tokyo, the Tour de France. Pretty much everything got canceled or postponed indefinitely. Schools and daycare centers went into lockdown, which means that the kids had to stay home. And so did their parents. A lot of people started working from home, which could put a lot of pressure on some family life. Shops and restaurants closed, whereas at least in Germany, at any given point in time, supermarkets, pharmacies, and some other relevant institutions remained to be open. And was never actually forbidden to leave your house, as long as you wouldn't gather with members of other households. Luckily, the weather at that time was unexpectedly nice. We're talking about April, where it can be, well, quite mixed, the weather. But since we experienced a very mild April, the mood was still kind of good in the early days of the crisis. And on 11th of March, the World Health Organization officially called it a pandemic. And also our Chancellor Angela Merkel pointed out to the public that due to the characteristics of the virus, and also the painful experiences other countries had already made at that point, we were also at risk of overloading our healthcare system. Or in short, there'll be sacrifices to be made to make sure everybody who needs intensive care medicine or respirator therapy would be taken care of. That is a sight I've never seen in my lifetime, and hopefully never will see again: empty shelves in a supermarket. Even though the general understanding and acceptance of these measures, especially in the beginning, was very high, people felt kind of insecure, and some started prepping and hoarding. And the first things to run out of stock, out of all things, was toilet paper, then pasta and canned food. Every food with a long shelf life, of course, makes sense. And this shortage lasted a couple of days before the supermarket caught up with the demand, but it turned out to be unnecessary. It was never an issue to get groceries. More importantly, the German stock market crashed, of course, also following a worldwide trend. It experienced its biggest decline since 9/11, 2001. I'm talking about the terrorist attacks from New York. With a quick recovery, not yet to baseline values, but still there seems to be hope, or at least a lot of people who feel like this is a good time to invest in the stock market. But not everybody was infected by this pandemic in the same way. As an employee without kids, a lot of people, of course, appreciated to work the chance from home without having their daily commute and still being fully paid. But if you had to work from home and take care of 3 kids, that could also get old really fast. But let's not forget about the entrepreneurs and shop owners who still had to pay for their running costs and their personnel sometimes. Without any income, they were actually threatened in their existence. And to prevent mass extinction of small businesses and risking millions of unemployed, the government granted immediate financial support for those in need, with this financial support being anywhere between 9,000 and 25,000 euros, depending on the size of your business. The most surprising part for me at that point was how fast and unbureaucratic this process went down. In the beginning of the crisis, experts and politicians were kind of restrictive with their recommendations concerning face masks, probably because a general recommendation to wear face masks in the early days of the crisis could have led to a shortage in the healthcare sector. Given that the worldwide demand of face masks skyrocketed virtually overnight and the resources had to be distributed carefully. And on the 8th of June, a study was finally published that confirmed the efficacy of face masks in public places. That study also had processed data that has been gathered in Jena, a German city which first made face masks in public places mandatory. Later on, face masks became mandatory in almost every confined public place like supermarkets or public transport, and people got educated about the different types of face masks, what kind of protection they provide, with the FFP2 mask with the valve being pretty much the only one to have full protection for the wearer and his surroundings. And on the 2nd of May, for the first time, people were actually demonstrating against the corona-related restrictions. While the vast majority of German citizens agreed and complied with the rules, a counter movement had already formed and was unfortunately also joined by a lot of opportunists like conspiracy theorists, fascist groups, and many, many more who sort of rose to the occasion. And from the beginning, it seemed to be the goal of politicians and scientists alike to educate the general public about the current situation. But because here in Germany, in this part of the world, generally speaking, it would be impossible to make people comply with the rules unless they have a rough understanding of the underlying logic. And these demonstrations just go to show that it's, I guess, always impossible to reach each last one of them. I guess with any given message, but still obviously enough to make the system work. In a huge media campaign, the politicians and scientists published the information derived from the observations that we had at the time, which was not a lot in this brief period given. And it was crucial for the people to understand that even though we are dealing with flu-like symptoms, or this coronavirus may also mimic the flu in some ways, there are in particular 2 characteristics that made this virus more problematic than the regular flu. Firstly, it seemed to be more contagious, and it had secondly a higher rate of severe cases who needed to be hospitalized or even need ventilator therapy. And pretty soon risk factors were identified and communicated with the public to provide a special protection for those who are at risk of developing an acute respiratory distress syndrome. And that is especially cardiovascular diseases, diabetes, high blood pressure, the usual suspects, I would say. And the first thing that also needed to be clarified was that if a virus, say, is twice as contagious as the flu, which it isn't, it's used to be more like 2 to 3 times more contagious, but that doesn't mean it's twice as bad. It is actually more like the flu to the power of 2, because we're dealing with an exponential function. Of course, this totally oversimplifies the problem as well, but it provides a better understanding for those people without any scientific background to understand the magnitude of the problem. The actual mathematical models are way more complicated than that, and I myself didn't really go into that. But due to a huge media campaign, soon enough, everybody would know what a reproduction number is and why it is such a key variable in epidemiology. Mostly because minor changes of this reproduction number may cause dramatic differences in the number of infected people. I hope you can see this animation here. Especially when the reproduction number exceeds 1, every decimal starts counting, and you can see how quickly the peak gets sharper, sooner, and higher. And yeah, we're dealing here with a nonlinear system. So this is sometimes a little harder to understand and may also be counterintuitive, but a lot of people got the message. And after the lockdown had taken effect, we managed to push the R0 below 1, which is good. It means that the number of infected people remains either stable or even it went, at some point, it went down a little. So that by mid-May, we could loosen the measures step by step, of course, helping those first who were struggling economically. Mostly gastronomy, but not exclusively, of course, also tourism industry, aviation. They all struggled and are still struggling, I have to say. I guess this is also a big deal in Hainan. At least that's what I've heard. So the next thing we needed to communicate was, why can't we just get it over with? You know, like the flu season, just let the wave roll by. Well, people needed to understand that the percentage of severe cases in COVID patients could easily overload our or any other healthcare system if a lot of people get infected at the same time. So with this graph, we introduced the concept of flattening the curve and always work within the boundaries of our healthcare system, thus not necessarily reducing the all-over number of cases, but reducing the peak number of those who need intensive care therapy. We had around 11,000 available hospital beds with the possibility of ventilation. And thanks to the early measures and a generally compliant public in Germany, we never actually came close to reaching the exhaustion of our resources. We were even able to help out our neighbors, Italy and France, thereby reinforcing the European idea. And speaking of European solidarity, on the 13th of May, Germany ended the border controls to neighboring countries that were established in the early days of the pandemic to prevent rapid spreading across country borders. There are still border controls right now if you return from risk areas, but I'll talk about that a little later. And on July 21st, after 4 days of allegedly very hard negotiations, the head of European countries passed on a resolution to recover EU economy from the aftermath of the pandemic. And with a total of 1.8 trillion euros in the next 7 years and 750 billion euros in the next 4 years, this was the biggest deal in the history of the European Union ever. So where are we right now? Most recent official data show a total number of 220,000 cases with less than 10,000 dead people in Germany as we speak. In most German states, the summer holidays are ending right now and the schools are reopening on Monday of course, with a lot of precautions, but still the impact of that will have to be evaluated critically and also in a timely manner to avoid wildfires. And the general strategy now is to react locally to control regional outbreaks before they become a nationwide problem. And that's pretty much what France does. In France, the amount of confirmed cases is comparably high, but as one speaker today already had outlined, I can only agree with that. Bear in mind that it is also always a question of how intensive testing takes place. Statistically, more representative, of course, is the number of fatalities, which in France is 30,000 people. And just yesterday, Paris and the region around Marseille have been declared risk areas, meaning that the authorities can pass restrictions at any time. And more importantly, if visitors return from risk areas back to Germany, they are obliged to either take a corona test on the spot or go into quarantine for 2 days. And the same is true for Spain. Apart from the Canary Islands, it's also been declared risk area. Also a very high number of confirmed cases and close to 30,000 casualties. And as I said, Italy was stricken the hardest because they got involved pretty early on in the pandemic. Their death toll has now exceeded 35,000 people. And as Dr. Garcia pointed out earlier today, the number of infected or confirmed cases, if you want, so may vary significantly from the number of actually infected people. And I can contribute this study here. It has been released yesterday by the Robert Koch Institute in Germany, and it had published data from a corona hotspot in Germany, a place called Kupferzell. Don't ask me where that is. They found out that out of a sample of pretty close to 2,000 participants, 7.7% had antibodies to the coronavirus, which is 4 times higher than the initial count. And this leads us to believe that there's always a huge number of unreported cases, and that with a prompt reaction to a regional outbreak, still over 90% of the population may be spared if you act quickly. But many more studies of that nature are on their way and about to release in the days and weeks to come. And then we hopefully know more. So what could future scenarios look like? It could be what it is right now, a dynamic equilibrium of outbreaks and countermeasures which result in a wave-like form, or what's labeled here an undulation. Or as winter comes and climatic conditions change, we could as well experience a second wave, just like in the annual flu season. That would actually be very bad, because then we need to go back into lockdown. Or maybe we eventually find the exact right amount of restrictions and freedom to keep the number of infected permanently under control and hopefully low. But let's not forget about the fourth and probably most convenient option for all of us. Somebody finds an effective and safe, most of all safe vaccine. Russia was among the first countries, or it is actually the first country to approve a COVID-19 vaccine after a very, very short trial period. And experts have raised concerns because it uses the adenovirus 5 vector to deliver the surface protein gene from the virus. Other studies with the same design or using the same mechanism had been aborted, not because of that reason, but still it is a bold move. And the manufacturer is called Binopharm and is located in Zelenograd in Russia. And the company says it can produce up to 1.5 million doses per year, which is not a lot considering that we need 60 to 70% of the population to be immune to have what's called herd immunity. It remains to be seen if this ambitious advance is indeed a Sputnik-like historical event, as it has been dubbed by the President Putin. I certainly cross my fingers and hope so, because usually it may take up to 6 years for the 3 phases of clinical studies to be finished, and that doesn't really mean that the drug or whatever we're talking about is on the market the next day. So let's see what's going on there. In any case, as probably everybody on the face of the earth, I truly hope we're in a better place in 1 year from now, so that we can finally meet in person. Until I send you my warmest regards. Thank you all very much for listening. Take good care of yourselves, stay healthy, and hopefully see you soon.